Good evening. This is Dr. Anthony Pais with 30 years of experience in breast cancer. Let me talk to you today on chemotherapy, immunotherapy and radiation therapy in breast cancer. Is chemotherapy very important for all patients? Yes. Chemotherapy is needed for any tumor more than a centimeter in size. Today you have certain tests, especially if you come early and diagnosed early, and if you also have a good pathology backing you, then we can do certain special tests like the Oncotype DX or the Can Assist test, which will sort of guide you. It's not 100% accurate, but can guide you and see whether you can avoid chemotherapy. But most often, chemotherapy is given to large tumors with a not so good biology. Now, chemotherapy, there are various drugs used, but the most common drugs used today are adriamycin, cyclophosphamide, taxols, paclitaxel or docetaxel, or epirubicin, and various combinations of these drugs. These drugs are given every 3 weeks for about 6 months. So your chemotherapy should end within a period of 6 months. Chemotherapy sometimes is given before surgery to reduce the size of the tumor so that the final defect in the breast is less and surgery becomes a little more easier. But sometimes, especially in early cancers, we give chemotherapy after the surgery, and which is usually started about a month after surgery and continues for a period of 6 months. Don't be afraid about pain. People think that there's pain in chemotherapy. In chemotherapy, there is absolutely no pain. There are many side effects which can be handled very easily with chemotherapy. The only possibility of hair loss, which nobody can do anything on earth, is something which you'll have to tolerate for some time. But once your chemotherapy is over, within a month from the last dose of chemotherapy, your hair will start growing. Within a period of 3 to 4 months, you will have your hair back. Immunotherapy is given if you are HER2 positive. This is a type of an oncogene which, if positive, we have to give you drugs like trastuzumab. This drug is a little costly, but fortunately the cost has come down to a great extent, and which has to be given every 3 weeks for a period of 1 year. It has got a lot of benefits if given to HER2 positive patients. The side effects are hardly anything. There are many other newer drugs which have been found out for immunotherapy, but you must have targets for which you do a lot of genetic analysis, mutations which can be tested, and then these drugs tried. So there's a lot of hope for cure in future with chemotherapy and immunotherapy. But the most important treatment in breast cancer is still surgery.